Welcome to the Gifford Provider Podcast, the podcast of Gifford Healthcare located in Randolph, Vermont. I'm Scott Fleischman, the communication specialist here at Gifford. Gifford's a nonprofit critical access hospital and federally qualified health center with a total of 9 locations. The medical center in Randolph is home to a 24-hour emergency department, inpatient and rehabilitation units, a renowned birthing center, accredited cancer program, advanced diagnostic imaging, surgery, and much more. You can go to giffordhealthcare.org to find all the services we provide. One of the specialties that we serve here for our community is dietary services. And our guest for this episode is Anne Hutchinson, registered dietitian here at Gifford. We're going to get into all of the reasons why she decided to become a registered dietitian. And we're going to talk about how she is now certified to treat celiac disease and other dietary related issues. So that's going to be some interesting conversation. But before we talk to Annie, if you are watching us on our YouTube channel, thank you. Subscribe to the channel, like this video, click the bell for notifications. That way this video will be seen in front of more people and you will be notified whenever we have something new on the YouTube channel. We are posting new videos all the time, patient testimonials, employee testimonials, just cool things going on here at Gifford, and of course, informational material as well. And we are also available in audio form on Google Podcasts and Apple Podcasts, as well as Spotify. You can give us a subscribe and leave a comment as well and a review. Those help us get more traction and more of this great information out to the community. If you are in the area and you do want to come to Gifford, there's so many services and locations that we provide. You can go to giffordhealthcare.org to check all of that information out. If you're interested in a career in the medical field, or if you're interested in a different type of career, we also have non-clinical positions such as cook or a kitchen assistant. We have positions in environmental services. So we have plenty of jobs for you as well if you're looking for something on the non-clinical side. giffordhealthcare.org/careers. Okay, with all that out of the way, Anne Hutchinson, thanks for joining us on this edition of the Gifford Provider Podcast, and congratulations on your recent certification. You can treat celiac disease and other dietary challenges. And I know that means a lot to you.
Yeah, thanks for having me, Scott. So this recent certification is specific to just treating any type of gluten-related conditions. So celiac disease tends to be the first thing that comes to mind, but I think over the past couple of years, it's become a big topic of interest for a lot of people. So I felt like it was worthwhile kind of diving more into, since our education does cover it, but there's only so much information you can get on a broad variety of topics, throughout undergrad and whatnot.
So talk to me about the process and what you had to do.
Sure. So I kind of stumbled upon this, not by mistake, but just by happenstance. So the Celiac Foundation provides really great resources, and I've had quite a few patients with various conditions that could be related to gluten. So, as I touched on, celiac tends to be one of the most common. However, IBS or irritable bowel syndrome is another condition that's a pretty non-specific condition. It's not super well known about, but one of the potential causes of some of those could be gluten-containing foods. The Celiac Foundation was actually offering a grant for dietitians to take this training. So I felt like it just, I kind of discovered it at the right time and was able to take advantage of it.
How did you become a registered dietitian? Was there something in family history, something with you personally, where you were just like, this is the road you wanted to go?
Yeah, that's a great question. So all throughout high school, I was determined to go to school and become a third grade teacher. And then I kind of felt like I like the idea of being able to educate people, but started developing more of an interest in the medical field as well, but kind of knew like, okay, nursing's not really my thing. I'm not a huge like needle and blood type of person. So thinking outside the box, nutrition came to mind because it combined, being able to do more group education if I wanted to. I've always been very passionate about food and where my food comes from, and I love cooking. So my mom grew up on a dairy farm, and she was actually a home ec teacher as well. And then my dad's mom was also a home ec teacher. So I grew up, around the food pyramid being all over my house, magnets and stuff, and, would have conversations about nutrition and cooking and gardening and food preservation. So I felt like it combined all of my interests really well. So, my interest in education, my love for food, and then my interest in healthcare. So it just felt like a really good natural fit. I also did the VAST program. So where I took all my courses my senior year of high school at VTC, and I took a nutrition class and really enjoyed it. And, enjoyed taking more science heavy courses. So, it just felt like a really good fit for me. And throughout undergrad, I just really loved all of my courses. Then felt a little bit like I wanted to complement that in a different way. So I knew I wanted to go to grad school, but rather than doing a traditional Master's of Science program, I got my Master's in Public Health. So that area of nutrition is a little bit more, higher level thinking, policies, program planning, stuff like that. And so I think that gave me a really good balance to my really clinically oriented undergrad education.
We always feel strongly that well-child visits are important for keeping track of your child's development, both physically as well as emotionally and socially.
This is the greatest time of all during the summer to come in for your checkup if you can, because there's no school conflicts and such. And we want to hear from these families again and check in and see how things are going.
So you joined Gifford at the start of 2022, and you've gone through this certification now to treat celiac disease and other dietary challenges, gluten-related disorders, which I don't think we knew about 15, 20 years ago. That just wasn't a thing you heard. So what do you think? What have you learned where that sort of developed over the last couple of decades?
Yeah. So I think certainly it existed. It was just less talked about, which in some ways I think is a really positive change that's happened, especially for those individuals who do need to restrict gluten from their diet. Thinking back to 15 years ago, you didn't hear about it. And so those individuals really struggled, especially with eating out at restaurants. And, doing their food shopping was a really huge challenge. So, I think part of it is that over time and, the kind of changes to our food supply happens gradually over time. But that's one, potential thought as to why they're more common now. I think another, reason why is that we have more information. And so we're better able to diagnose these conditions. So, with celiac, they've identified some genes that are present in 95% of people that have celiac disease. So, if you're trying to rule that out, if you test someone for these genes and they don't have them, it's a fairly good bet that it's probably not celiac disease. So, I think that certainly we just have more information and resources available to us to be able to diagnose it. I do think there's a portion of the gluten-free phenomenon, I guess I'll say, that's a little bit kind of a fad, because I think carbohydrates are kind of demonized now. And so, gluten is the protein in wheat. So any type of wheat containing product also has gluten. So kind of that overlap of those foods, I think, kind of give gluten-free foods what we call a health halo effect. So when it, you see certain keywords on a food label, it triggers in your brain, oh, this is a healthy food. And I'm not saying that gluten-free foods aren't healthy. It's just that it doesn't necessarily make it superior that it's gluten-free. So yeah, a couple of different reasons for that.
How do you work with folks who have these, gluten-related disorders? How does that go?
Yeah. So depending on what their specific diagnosis is, will kind of tell me information about how stringent we need to be with restricting gluten. So starting with celiac disease, that's an autoimmune disorder triggered by gluten. So what happens in the body is when you consume gluten, it triggers this immune reaction that attacks the gluten, but also your small intestine. So it flattens out the what's called villi. So they're little finger-like projections in your intestine that help with absorption of nutrients. So, if celiac disease is not treated and, the individual with celiac disease doesn't completely restrict gluten, it can lead to, some pretty serious health consequences down the road, especially pertaining to malabsorbing food. So not being able to absorb all the nutrients that you need. So in those situations, we want to be really deliberate about educating on what foods contain gluten, what to look for on food labels in the grocery store. And then also, knowing what questions to ask when you go out. Part of this training I took was really focused on what are the social implications for people who have celiac disease and gluten-related disorders. It can be a real challenge to feel like you're so restricted when you go out. And some people just don't want to because they're like, well, what am I going to eat? Especially at first, I think that when anyone receives a medical diagnosis, there's an element of kind of fear and panic. And so it's normal for people to want to have more control over their situation. So, with celiac disease, being really deliberate about educating on restricting gluten altogether, avoiding cross-contamination, all that kind of stuff. With, gluten-related sensitivity or food intolerances, I kind of allow patients to tell me what really bothers them. Of course, restricting gluten is the ideal world because the symptoms that they have are not always the most fun. So, having abdominal pain and gas, it can manifest in constipation or diarrhea sometimes. So, those are all symptoms that aren't ideal. Sometimes people are like, well, if I eat a little bit, it doesn't bother me as badly. So I'll have a small serving of something with gluten, which, I feel like if it doesn't bother them too much, it's not causing medical harm, then that's ultimately their choice. So there's a little bit of a spectrum in the way that I would treat the disorder depending on what it was specifically.
You mentioned a couple of the symptoms or signs that there might be something wrong. There's some other really bad Crohn's disease is another one.
With Crohn's disease, it's a little more complex than just diet, but certainly there are dietary interventions to help alleviate some of the symptoms people are experiencing. And then, if they have to undergo, so one of the treatments is to get part of your bowel resected, depending on where, that irritation is happening or inflammation is happening. So depending on what part that is, there's absorption of nutrients that happen all throughout our digestive system. So, coming to a dietitian to make sure that you're getting enough of those nutrients that, if one part of your bowel was taken out and it's the part responsible for absorbing iron, for example, you want to make sure that you're receiving, enough to be able to not be lacking in that nutrient. So yeah, that's definitely something that I am able to help troubleshoot any problems with.
Crohn's is that's another disease that's really come a long way in treatment over the last, decade or so. 20 years. My cousin growing up had Crohn's, and, it was really a struggle. She was on steroids for treatment for a long time, and she, blew up, and that wasn't a really, that just wasn't the best way to treat it. And then eventually she had the surgery, and now she's on this really strict organic diet, and it seems, and it's been under control. But Crohn's is just it's, again, like I said, it's something that, 20 years ago, you were in a lot of trouble. There was not really a lot of good ways to work around it.
Yeah, absolutely. It's, it's great to see how far our medical system has come and be able to have, not just one answer for every diagnosis. And I always like to take the approach of what are some positive things we can add to make you overall more healthy. I think that rather than coming from a place of restriction, it can be more empowering for people to think about healthy options that they can start incorporating more of, and just kind of, gradually transition into an overall more well-rounded diet.
It's my hope that here at Sharon Health Center, we will be able to help you get any level of injury under better control. And if we can't take care of you here, we will definitely get you to the people who can take care of you.
What advice would you give to somebody who has, struggled with weight loss, and they finally, are able to kind of keep, get the weight off, but are nervous that they're not going to be able to keep it off? What would you say to those folks?
Yeah. And I think that, one thing I do try to reframe is, of course, there's an importance to feeling comfortable in your body and at your weight. But there's also a lot of other factors that play into what our weight is. So, I think that oftentimes trying to shift the focus to promoting your health overall can be more meaningful. And the reason I say that is that sometimes people get really discouraged if they hit a plateau. And, that may be your body giving you information that you need to know. Or perhaps, your exercise routine is getting kind of stagnant and old. And sometimes our bodies just crave something new. So just changing something up slightly to have an overall improvement is helpful. I also think when we think back to, our predecessors and Paleolithic areas, whatnot, there was a real risk of starvation. And so our bodies have adapted to kind of conserve calories sometimes. So weight loss is really challenging, especially if it's happening rapidly. It does kind of signal to your body that you may be in starvation mode, which is, was dangerous back then. And right now we have, a lot of availability to food, but physiologically, we don't always know that. So, I think that really promoting a more gradual weight loss and a focus more on those positive lifestyle changes that we can make is more meaningful, just so that people don't get as discouraged by just looking at the number on a scale. We also know, of course, that muscle weighs more than fat. So, there's a lot of different factors that play into it that I think is also important to acknowledge.
So to see Annie or our other registered dietitian, Stacey Pelletier, you do need to be referred to by your primary care provider, but you're still taking people that are being referred to you. There's no wait, right?
Right. Yep. I have openings, pretty much immediately. So I'm welcoming new referrals at any point in time.
Okay. And if you want to check out, again, the services or our primary care providers, you can go on our website, giffordhealthcare.org, if you don't already have a primary care provider here through Gifford. But any summer, fall suggestions for folks as they head into maybe the new school year?
Yeah. So I think summer and fall is a really exciting time because especially in Vermont, it seems like a lot of people have gardens and there's berry picking and apple picking. So I think really focusing on trying to eat those wonderful seasonal fruits and vegetables that are available to you, or checking out the farmers market. Little plug for that here at Gifford as well, is something that can be really helpful and exciting this time of year, is that, there's plenty of wonderful treats available that, often you can either get from a family member that has a garden or from your neighbor, that are really, good for you and really refreshing in the summer months as well.
All right, Anne Hutchinson, registered dietitian here at Gifford. Thank you so much for joining us on the Gifford Provider Podcast. A lot of great information out there for folks, and hopefully if they liked anything they heard or anything piqued their interest, they'll talk to their primary care provider and get in touch with you.
Great. Thank you, Scott.
All right. Thanks very much again. You can go to giffordhealthcare.org, check us out, and we will be back here with another edition of the Gifford Provider Podcast next month. Take care.